as well as some general plan info, as well as wellness, and we'll talk about the rates, and then we'll have time for any questions that you might have at the end. So we're going to go ahead and get started. The state health open enrollment is started on yesterday, October the 17th, and it will be active through November the 4th. You're going to need to make your online election at www.myshbpga.adp.com, and you have until 11:59 p.m. on November the 4th to make that election. You can go online as many times as you like to make your elections, but the last election that you make will be, that's on there as of November 4th at 11:59 p.m. will be what will be in effect for the 2017 year. Please make sure that you print a copy of your confirmation page with your confirmation number on it, so you'll have that to make sure that there's no discrepancy between you and state health. You do have to update your the enrollment portal that every 45 days, and I know most of y'all have not been in here since last year, so you'll want to go ahead in and reset your password. If you forgot that, you can click on forgot user ID or forgot password, and it walks you through exactly how to log into the portal. Here are some of the things that are your responsibility. You're going to want to make sure that you look over the materials posted on the www.dch.georgia.gov/SHBP website. Now we're going to also put this decision guide and the rates and information like that on the Mountain Ed website, but you're going to want to, there's also a lot of additional information out there that can help you with your decision. You're going to want to make sure you confirm that you answer the tobacco surcharge question when you make your election. You don't want to have that $80 surcharge if you don't need it and you're not a tobacco user. Please make sure that in the December payroll that you check your payroll deduction to verify the correct amount has been taken out, or if you don't have a charge, or if you do have a charge, please email me as soon as that payroll is over if you have an issue that is incorrect, so we can make sure to get that corrected as quickly as possible. Also, if you have an address change, you need to notify Lauren Anderson about that as soon as possible, so we can make sure that that gets changed in our system, because we upload a file every month to State Health with those changes. Also, whenever you have a qualifying event, you have 31 days to notify State Health of that event, and we can help you with that process too. So if you get married, you have a baby, you have a divorce, your child turns 26, then those kind of things are qualifying events. If you do not make an election, then by the deadline of the November 4th at 11:59 p.m., then you're going to roll over with the same exact plan that you have now with the tobacco surcharge if you have one, and without the tobacco surcharge as if you don't have one. I like for people to go ahead and make a purposeful election to make sure that you know exactly what you're signing up for. That's going to continue for the next year, and that way you know exactly what to expect for the next year. So there are going to be the same vendors and plan option offerings for 2017. We're still going to have the options of Blue Cross Blue Shield and United Healthcare and Kaiser. Please keep in mind that if you're over 65, that sorry. No. Oh, hit cancel. So right here. Sorry. That if you are over 65, you'll pay the full cost of the unsubsidized premium for the plans, as the state will only subsidize the Medicare Advantage options. If you're Medicare age and you're looking at this webinar and you need some assistance, please email me, and I'll be glad to help you with that. Most people that are just active employees don't need to worry about the Medicare part, but any retirees might be interested in that. So like it shows here, the HMO is with Blue Cross Blue Shield and with United Healthcare and with Kaiser. And I'll talk about that more in detail in a little bit. But then you also have the high deductible health plan with United Healthcare, the gold, silver, and bronze HRA plans with Blue Cross Blue Shield, and then the Medicare Advantage plans. Also, some enhanced benefits that we just want to point out to you. There are telemedicine and virtual visits available through State Health. That started last year. And these are face-to-face consultations with doctors that are available to you 24 hours a day, 7 days a week, every day of the year, just from the comfort of your home. You have to just be able to log in. If you're interested in doing that, you need to go out to the State Health website, and you can, or your Blue Cross Blue Shield website, and you can get on and kind of get your account set up for that. And then that way, whenever you're ready to use it, it's available to you. You just pay a copay under the HMO, or you pay your co-insurance subject to your deductible under the gold, silver, bronze, or the high deductible plan. Also, the wellness incentive credits are going to roll over. That's going to continue to happen. They're going to roll over for both the vendor and the plan option you select during open enrollment for this year. And the credits will be available in April of 2017. So this allows for processing of any claims that are submitted at the end of 2016. So regardless of which state health plan or vendor you choose, you can take the credits and roll them over. So even if you have HRA now and you change to HMO for next year, or vice versa, whatever you have available at the end of the year will roll over. There also is a children's hearing aid benefit increase. So this benefit is going to go for children up to age 19 from $3,000 to $6,000 every 5 years. So let me just give a little information about how the health reimbursement or HRA plan works. The HRA provides first dollar coverage for eligible medical and pharmacy expenses and is funded by State Health Benefit Plan. When going to the doctor, you will not pay a copay. Instead, you pay the applicable deductible and co-insurance. If you have remaining credits in your current HRA account, those credits will roll over to the option and vendor you select during open enrollment. So as an example, this plan pays 100% of covered services provided by in-network providers that are properly coded as preventative care. That's very important. If you want your charges to be paid at 100% for all the wellness and preventative care, the doctor has to code them properly, or you will be charged for that, and it will use your HRA dollars, and also they will send you a bill. You must meet separate in-network and out-of-network deductibles and out-of-pocket maximums. So that's why it's important to stay in-network whenever possible. You're not required to select a primary care physician or obtain referrals to see a specialist. The credits in your HRA account are used to help meet your deductibles and out-of-pocket maximums. The medical and pharmacy out-of-pocket maximums are combined. And certain drug costs are waived if state health is primary and you actively participate in one of the disease management programs for diabetes, asthma, or coronary artery disease. If you're interested in finding out if you have one of those conditions and you want to find out more about that, you can log on to the Be Well SHBP website and get information about how to contact State Health and get signed up for that program. There's some steps you have to take, but it definitely helps you with co-pays and some additional out-of-pocket expenses that those conditions require. So the high deductible health plan offers in-network and out-of-network benefits and has a low monthly premium. However, you must satisfy a high deductible that applies to all covered medical and pharmacy expenses except preventative care. If you have any dependents, the entire family deductible no longer has to be met before benefits are payable for any family member. Additionally, once the out-of-pocket maximum has been satisfied for that individual family member, all covered medical and pharmacy expenses will be paid at 100% for that family member. You may qualify for a health savings account to set aside tax-free dollars to pay for eligible health care expenses. If you have remaining well-being incentive credits in your current health incentive account, those credits will roll over just like any other plan. So this is a plan you need to be very careful if you decide about this plan, because it is very high deductibles and you have a lot of exposure there when you're using this type of plan. So if you have questions about a high deductible plan, and as well as the health savings account, which you definitely need to have go hand in hand with that, please email me and I'll be glad to give you more information about that. Then you have the statewide HMO plan. The HMO plan allows you to receive covered services from in-network providers only, except in an emergency. That's the one thing you have to remember about the HMO. You have no out-of-network benefits. You need to make sure that you check your providers and make sure that they are all in the network. If you have remaining well-being incentive credits on your current Blue Cross Blue Shield My Incentive account or your United Healthcare incentive account, those credits will roll over to the plan option or vendor you select. So Blue Cross Blue Shield and United Healthcare both offer an HMO plan. They are both the same benefits. The only difference is the amount you pay per month, the premium for these plans, and also if you have a doctor that may be in one network or not in the other. So if you're considering choosing one or the other, just make sure that your doctors are in the network, and then you can make your choice from there. The plan for the HMO pays 100% of covered services provided by in-network providers that are properly coded, again, as preventive care. These subjects are certain services are subject to a deductible and co-insurance. You're not required to obtain referrals to see a specialist, but you're encouraged to see a primary care physician to help coordinate your care. You can go to any doctor you want to as in this plan, but you just have to, it's important that you stay in the network. And you also want to make sure that you are aware that most things that happen in the office are paid just with a copay under the HMO plan. The medical and pharmacy out-of-pocket maximums are combined. Copays count towards your out-of-pocket maximum, and certain drugs are waived, just like under the HRA plan if you participate in the disease management. It's called a disease management copay waiver program. Then you have the Kaiser plan. If you are in one of the counties below that are highlighted with the asterisk starting with Barrow County through Walton County, and you're interested in the Kaiser plan, please email me and I'll be glad to talk with you more about that. There's not very many people in our area that are eligible for Kaiser, but it is a really good option. It's a really rich plan if you are in one of the participating counties. So please call me if you need more assistance with that, or email me, I'm sorry. So the pharmacy benefits are going to remain the same for the next year. Express Scripts will continue to administer the prescription drug pharmacy benefits for members who choose Blue Cross Blue Shield and United Healthcare. So there's no really change in that. You can still get a 90-day supply of your medication through home delivery services, and you can get help with managing your prescriptions with them as well. So the wellness plan. The Blue Cross Blue Shield and United Healthcare, for Blue Cross Blue Shield and United Healthcare elections, State Health is going to continue to partner with the wellness vendor Healthways to provide members who elect Blue Cross Blue Shield Georgia and United Healthcare with well-being resources and incentive programs. If you want to have, you still have a little bit of time, about a month and a half left, or actually 2 months left if you want to get your health actions done for 2016. They have to be completed by December 15th in order to earn the well-being credits. And next year you'll have from January 1st to December 15th to earn those credits. Members who elect Blue Cross Blue Shield and United Healthcare will have access to a variety of Healthways tools, activities, and services, such as the well-being assessment, wellness incentives, well-being coaching, biometric screenings, and on-site activities. Members can earn 480 well-being incentive credits towards eligible medical and pharmacy expenses, plus up to an additional $480 for covered spouse. One thing I want to tell you about while we're on the wellness page is the way the wellness plan works with the HMO is once you go to the doctor, you pay a copay, you have wellness incentive dollars in your account, then in a few weeks State Health or Blue Cross Blue Shield actually will send you a check for that copay back. If you go to the pharmacy and you pay for your prescription, then you can, in a few weeks, if you have if you have wellness incentive dollars, you'll receive a check back for that. If you're on the HRA plan and you have wellness dollars available, then they will reduce the cost of your charges by those dollars, and then that's what the amount you'll be billed is the difference. So those amounts can really help you and your family. So please take advantage of the wellness money that the state basically is providing you to help pay for some of your medical expenses. So here's how you earn your credits. First of all, you have to do a well-being assessment online, and you have to have a completed biometric screening. Now, the biometric screenings can be done at a state health sponsored event. There's the White County school system has these every year, as well as different systems around Pioneer RESA. You just have to go online and you can look up where those are, or you can print a physician screening form out from the Be Well SHBP website and take that with you to the doctor. Once those two things are done, the screening and the health assessment, that gets you 240 well-being incentive credits. Then after that, if you engage in telephone coaching, or if you engage in completing well-being assessments and recording 5 online activities, then you can get additional $240. The easiest way to take care of this second part is to just do telephone coaching. I think you only have to talk to them 2 times a year to get that incentive put in your account. So it's really worth it, and it really helps you think about just ways that you can be healthier. Kaiser Permanente has some additional wellness incentives. So like I said, if you're eligible for Kaiser, then you can please contact me or look more into that. There's lots of contact numbers here for Blue Cross Blue Shield, the website. If you are a Blue Cross Blue Shield member, you should log on to the www.bcbsga.com/SHBP website. Make sure you have an account there. You can log in and set up your, to look at your claims. You can look at how much well-being incentive credits you have available, and all kinds of information on that website. Same with United Healthcare if that's your provider. Healthways, the www.bewellshbp.com is where you print off your form to take with you to the doctor. These forms have to be personalized to the individual. You have to put in your name and your zip code and your date of birth, and that prints out a form with your specified number on it, and you take that with you to the doctor. Express Scripts is where you can call or log in to get more information about your prescriptions. Member services with State Health Benefit Plan, that number is 800-610-1863, and the myshbpga.adp.com is where you're going to log into the portal, and you can also look at different resources there. If you're interested or need information on Peach Care, that information is here. Also, if you're family or part military, retired military, or even active military, you can look at the TRICARE supplement. So this is just basic information to guide you in making your decisions for this year, for the open enrollment period. We are going to put this presentation, as well as the active employee decision guide and the Mountain Education rates, which I'm going to tell you about in just a minute, on the benefits on the web page under employee benefits, and we'll send you a link for that. And so let me quickly just show you the rates. They've changed very slightly for this year, and Mountain Ed is, as an employee of Mountain Ed, we're fortunate that Mountain Ed pays $50 per month towards your health insurance. So the rates that are shown here are the rates for that include that $50 already deducted. So for example, if you choose Blue Cross Blue Shield HMO just for yourself, the regular rate for that is $130.96, but as a Mountain Ed employee, you only pay $80.96. So you can see that it went up slightly from last year if you're used to seeing these rates. If you have HMO for you and children, it's going to be $191.94 instead of, I think, $190 was the rate before. The employee child, actually it was $240.05, so it's just gone up very slightly. But these are, just so you can see, these are the rates that are going to be effective January 1st, 2017. So I would like to see if there's anyone that has any questions at this time.
You guys can type them in the chat, or if you unmute yourself, you can ask a question if you have any.
Well, one other thing that I would like to show you is I've sent as in an email the active decision guide, and I'd like to just show you that real quickly so you can see what that looks like. All of the plan, the same information that we just gave you as far as the phone numbers and the contact information are all in there right when you open the booklet. And then also, if you want to look and see exactly what your plan would look like and what the deductibles are and what the out-of-pocket expenses are, then you can start in the booklet on page 20 of the booklet. That shows you the difference between the gold HRA, the silver HRA, and the bronze HRA. Basically, the bronze is the least expensive plan and the highest deductible. The gold is the most expensive plan with the lowest deductible, and then the HMO plan is a little bit less than the gold, and the deductible is a little bit less than the gold also. So it's a good idea just to scroll through this and kind of get information about your plans and how things that come up might be paid or might be processed. But if there are no other questions, then that'll be all for today, and thank you for attending.
All right, I got one.
Okay.
The dental, what's the website for that, for doing the dental and all that?
I'm glad you said that. I forgot to mention that at the beginning. This open enrollment is only for state health benefit plan, your health insurance options. The dental and the vision and all that will be in the spring for July 1st effective date. So this is only for state health insurance right now.
Okay, July.
Unless you have a qualifying event during the year, but other than that, this is not the time for that one.
Okay. So at that time, do we do the HRA? I mean, not the HRA, the flex spending account. Is that when you do that too?
Yes, that would be in the spring also.
Okay.
Currently, we don't have a flexible spending account as far as taking money out of your check for those medical charges. But I'm not sure if that's going to be something that would happen next year or not. But right now, there is not one.
Okay.
Well, if anybody has any questions, you can email me at laura.corley, CORLEY, @mymec.org, and I'll be glad to help you in any way that I can. Thank you very much, and y'all have a great afternoon.
Thank you.